I'm Leanne Meier, and this is Once a Nurse, the original. We are having so much fun doing these podcasts with all of the people that are going to be sponsoring and speaking at Once a Nurse, not at Once a Nurse, at Power Up Nursing in June in Orlando, Florida. And it's June 22nd to the 24th. Many of you have heard lots and lots of information pieces we've been sending out through social media. And I hope you've been hearing about it also from other people that you know of. We are really getting excited because we're like a month away now. And so many things are really falling into place. And we're really getting ready to welcome all of you to this very special conference. So the podcast that we're doing today is special for me because we're going to be working with and talking with two people that I met 3 years ago, January 2020, in the worst blizzard, freezing snowstorm Minnesota can offer. I live in Minnesota, and I invited these people to come and to be with them, and it was awful. I mean, the weather was awful. The conference was great. And the important thing to me is I'm somebody who, I'm a nurse, obviously, and I have had tremendous pain in my life since birth. I've had birth defects. And so, of course, being a nurse just made those things even more challenging and traumatic. And it didn't take very much to exacerbate the problems that I had. Pain levels in the 8 to 9 range was not out of the question for me. And so I came to this conference with not really much expectation. And then I found out that these two people that we're talking to today were going to be there. And they were going to be doing an introduction and what's the word I want? Introduction and anyway, helping people to experience somatic functional therapy. I'd never heard of that before and had no idea what it was going to be. But I was in a lot of pain during that beginning, the first couple of days of that conference. And so when they came on and there was a question, does anybody want to volunteer to experience this? I had my hand up first and I was almost running up to the stage before they could even look around the room. I will talk a little bit more about what that was like, but first I'd like to bring in these two guests who started out just to be complete strangers and then have become very good friends. So Dr. Ramon Nunez and Dr. Alba Rodriguez, they are both involved together. They're working on somatic functional therapy and in the work that they've been doing now for quite a while. I prefer to have my guests tell about themselves, and so I'm going to do that. Dr. Nunez is the president and founder of the Somatic Functional Therapy clinics and business, basically. And Dr. Alba Rodriguez is the chief science officer for the Somatic Functional Therapy organization. So welcome. Thank you so much for being here. It makes me feel better just looking at you.
Thank you so much, Leanne.
Yeah.
It's a pleasure to be with you today. We love watching your podcasts and we feel honored to be on one.
Oh, thank you so much. And I would be honored if you could share, each of you, just a little bit about who you are, like how you got to be to this place, and then why somatic functional therapy. And then we're going to go into talking about why nurses? Why do you want to share this with nurses? So let's start with maybe Dr. Nunez. I'm going to call you Ramon after this, but
thank you.
Dr. Nunez, could you share with us kind of your background, which is pretty impressive?
Absolutely. My background started essentially, my healthcare background, I'll say, started essentially in martial arts. I have been a martial art practitioner over 60 years, okay? And part of that training had to do, when I became an instructor, had to do with how do you deal with injuries that occur in class, okay? In the same way that as a martial artist, you think, well, how do you deal with a wound in battle? You have to be prepared to deal with it and move on, or you're going to die out there. Okay, well, martial arts offers that same opportunity. And as fate would have it, I took a liking to doing that type of work, helping people, working on people, teaching people. And so going back to the early 70s, I co-created a stress management program that was offered to police officers, prison guards, school teachers, and nurses. Okay. And this was stress management, but with a slightly different leaning than what we would talk about today.
Okay.
Coming from a martial arts perspective, part of it was, okay, how do you deal with the stress of the job?
Yeah.
But also part of the job for nurses in the inner city of Camden, New Jersey and Philadelphia, where I was teaching, had to do with how do you deal with somebody going nuts in the ER and attacking a nurse? All the stress management in the world is not going to help you with that. And so we trained the nurses not only in stress management and how to deal with what all that would entail, but how to physically deal with that. And that gave me a certain, I guess, recognition of what nurses, school teachers, police, were, what they were under. What was their level of stress? Well, that led me into further health studies that got involved in Chinese medicine, where I have a doctorate in acupuncture and traditional Chinese medicine. But
got that education in the Far East, correct?
Oh, yes. I studied in China. I've studied actually quite a few places, in America as well, in Canada as well, in China, in Japan. But pursuing that track, not unlike Western medicine. Western medicine does not have the answers for everything. Well, guess what? Neither does Eastern medicine, neither does holistic or any, name you want to give it. The real answer is in understanding what we as human beings go through in life, and how do we deal with that? Do we deal with it with drugs? Okay, sometimes that's the most appropriate way to deal with it. Do we deny ourselves surgery if it's necessary? No, I don't think anyone would deliberately. But how about in lifestyle? Stress. Everyone says that, it's such a buzzword nowadays. I was doing stress management seminars in 1970 for nurses. So this is not a new buzzword, but one of the things that I guess coming back to was that there was no real, this is the solution. This is what you should follow. But I, like many who were in the alternative community, shall we say, explored a number of different practices. And one thing that I used always, as a guideline was it has to make sense. If it doesn't make sense to me, then I'm going to investigate it. But if it doesn't make sense, I'm moving on. And that gave me an opportunity to not only study acupuncture and herbal medicine, but manipulative practices, working with the body, herbal medicine, nutrition, always looking for, okay, what's going to work? What can I really help these patients with? And sometimes acupuncture worked great. No two ways about it. Sometimes manipulation was amazing. Sometimes an herbal recommendation solved problems that had been there for decades.
Yeah.
But it wasn't consistent. I couldn't duplicate that in the way that I thought. So I continued to practice. I continued to develop, I guess, my own understanding of what patients were presenting themselves to. Now, because you got to understand that as what was considered an alternative practitioner, most people weren't coming to me first. Most patients were coming to me after many had run the gamut of what Western medicine had to offer, and also often when they tried any number of other alternatives, shall we call it. And then they would come to me, oh, I need your help, help me. And part of it is trying to understand not only what the patient presents with, but everything else that you have tried, and how has that impacted you up until that very moment when I would treat someone or address someone's issues. And so, I practiced for almost 40 years, seeing patients essentially for everything from A to Z. Why? Because I'm so brilliant and have all the answers? No, because patients would come to me and they would say, hey, look, I'm here because I've got multiple sclerosis and I've tried everything out there and nothing seems to help. And my approach was, well, what is multiple sclerosis? I don't think they still have a definitive answer, but I know that for the symptoms that patients were presenting, I had strategies that seemed to help.
Let's go to Dr. Rodriguez, and then I'm going to call you Alba after that. So tell me about your background is foundationally in research, correct?
Yes. I'm coming from the totally opposite side of things. I was getting my doctorate in psychology and neuroscience, working specifically with neurodegenerative diseases and other stress-related conditions. I was very interested in integrative medicine and what kind of treatments work and how can we get these to people sooner rather than later. So I went from working in the lab with animals on things like stroke, Alzheimer's, Parkinson's, you name it, but different types of kind of chronic illnesses. To when I graduated, I went to a major health system in Michigan where I met Dr. Nunez. And I was first working there in the lab also, but more with integrative medicine approaches. And then we opened an integrative medicine center, which was like the first of its kind in a major health system in Michigan, which was very exciting. And to me, because I was so interested in research and because I was interested in what can we do now to help a person now, not 10 years from now, which was the animal models were, 10, 15 years from now, if you're lucky. We started a research program out of the Integrative Medicine Center, and we wanted to see how are things working, right? Are people getting results? Because most of the people we saw were coming in, like Dr. Nunez said, for the things they couldn't get help with, right? With what their insurance covered. Their insurance covered the conventional medical care, and they weren't getting results that way, so they would come to us. And most of that was chronic pain and stress-related conditions. So we started monitoring everyone who came through the clinic. And one of the things I found when looking at a lot of this work was that we were getting really, good improvements. A lot of the practitioners were, but if I looked at where the results were really happening quickly and effectively, it was Dr. Nunez. He was seeing patients 3 or 4 times and they were getting out of pain and not coming back, because they were better. And I'm like, wow, that's great. What are you doing? And he explained to me about somatic functional therapy. And I said, wow, that's amazing. And it makes so much sense with what I knew about psychology and neuroscience. So we, wrote a grant for creating a new care pathway within the health system for chronic back pain. And the grant was we don't just want to create a new care pathway, but we want to test the different options and see which one works before we go and implement it. So we compared, that traditional physical therapy to this kind of everything but this kitchen sink integrative medicine to some of the protocols that Dr. Nunez had developed. And we found that, people improved in all the groups. But if you looked at pain resolution, chronic pain resolving, PT was only resolving about 5% of chronic pain. Compared to 25% in the somatic functional therapy arm, the group that included that, which was even better than everything but the kitchen sink. So that started whole 10 years of clinical research on not only chronic pain, but stress and stress-related conditions, because all of those are involved, right? In chronic pain and all these conditions are part of that umbrella of how stress affects us. And so that we spent 10 years of doing clinical research studies, including randomized controlled clinical trials. And what we found is very effective for chronic pain, for stress, for anxiety, for depression, for sleep disorders, for a lot of chronic illnesses, including blood pressure. People were controlling their blood sugar, all of these things, because they're all under that umbrella of stress.
And almost all of those things you just named, especially the sleep problems, integrate with each other and create more of the same problems that people have been having. And so, when you just start trying to deal with this, or deal with that, or deal with something else, it's ignoring what you all know and what many, many nurses have realized in our practice of nursing, is that it is all integrated. Our minds, bodies, spirits, everything is all integrated. And if you are only looking at one or another area, you're probably going to miss what is the foundation of this problem. And that's what I love that you guys are working with also. So let's bring it back to nurses, the nurses that you have both worked with. What are the things is there anything that nurses have in common in regard to pain issues, stress issues that you would see as people?
One thing before we go to, I want to make a slight correction to the text there. It actually resolved chronic back pain in 55% of low back pain, and 40% of all chronic pain conditions. Just a tweak there for that.
Thank you very much. Let's get it right.
Go ahead.
Okay. So bringing it back to nurses, do nurses have anything in common that creates more pain, more stress, more maybe reluctance to take the time to take care of themselves? What have you seen?
Your watch.
You what?
Your watch.
My watch?
That's one of the most common things that I see. Time. It's all about hurry up, hurry up, hurry up. Okay? And it's under threat. Remember, you have to hurry up, and you better not make a mistake.
Yeah.
Because we're watching you. Okay. You want to talk about stress? That's the stress that occurs the moment you pull into the parking lot at your hospital. Okay. That's the stress that's there the night before you have to go into work, starting your work week. Okay? That's there. And, what's the solution for that? Oh, well, we need a better administration. Yeah, no, that's not the solution. Okay. We need more nurses. Yeah, we need more stress nurses. That's the solution. More doctors. Is that it? No, we need integration. First of all, among everyone that's there. As we said, we worked with a major hospital system. At the time we were there, 24,000 employees, if that's an indication. And the people we saw, not only the general public, but we saw many of the doctors and the nurses and the physical therapists and the occupational therapists and the maintenance staff who were coming to us, again, with problems that aren't being resolved in their hospital system of 24,000 employees. And, I've treated over 50,000 patients in my practice lifetime. I never met a patient in pain who didn't have stress.
Yeah.
That doesn't happen, right?
Yeah. And whether one starts the other, it's the chicken or egg, but boy, they sure work together.
Yes.
And I just read a study yesterday from the Well-Being Index people that they did 19,493 nurse assessments in 2022. And they found that the percentage of nurses with a high level of distress was 57%. That's like threshold level above which, they consider it really high. So I think that's when he's saying time, that's one of the factors that leads into that stress. And that stress is what's really, and of course, obviously the nurses' stress has gone through the roof more than, and these studies show more than the physicians, more than other staff, other healthcare providers. So that's the key thing, the stress. And then how do you deal with that? Is it stop all the stress, or is there something we can do as nurses and as other professionals to impact how we respond to our own stress?
Let's take it from there. Say I'm coming into your, clinic, your facility, however, or maybe you're doing it virtually now. I don't know. But I'll take it. When I raised my hand to come up 3 years ago, I had absolutely no idea who either of you were and what you did. All I knew is I was in pain at that moment. And if somebody was going to offer to get me out of it, I was interested. And so the pain I was having was headache, jaw pains, spasms in my face, my neck, my shoulders, my back was in spasm. I had low back pain that I couldn't, relieve. Trying to think what else was going on at the time, but that's quite a bit. So when I walked in, you seemed to indicate that, I said, I'm in a lot of pain. And you said, I know. So what was it that I was betraying or showing that you knew already? You seem to know exactly where I was at.
Every patient that presents themselves to any practitioner, regardless of what their issues are, rarely do they walk in rattling off every symptom they can think of.
Yeah.
Okay? But still they present.
Yeah.
Okay. Well, one of the things that has fallen by the wayside in conventional medicine,
yes,
that is still held on to in traditional medicine, shall we say, is the art of observation, of really looking at that person as they present themselves. Your health history is important, no question about it. I want to know what has gone on, what's been done, what conditions you have dealt with, but I can't address any of that. All I can address is what presents to me today. And so when I look at a patient, I'm immediate. Not only am I looking when you walk in my door, if we spoke on the phone, I ask you questions and I listen to your voice. Mm-hmm. I listen to the quality of the voice, to the pitch of the voice, to the strain or the lack of strain, because all of that are indications of what? Of stress. Mm-hmm. Okay, I want people to understand, I want nurses to understand, stress is not a bad word, okay? If you didn't perceive the stress of your environment, you wouldn't have the sense to come in out of the rain. Okay? However, we do perceive that. Now, we don't think of it as stress, until it's freezing rain. All of a sudden, that same rain that we loved in the summertime is now stressful. No, it's how we adapted in that instance, determined whether that was a stressor, a pathological stressor or not. There's an example that you give regarding somebody winning a lottery or vacation.
Yeah. So imagine, and I teach this in the classes, that we just won a trip to Hawaii, right? All expenses paid. And it's like, wow, a free trip to Hawaii. Now, for one person, that may be, oh, this is so exciting. It's going to be so much fun. And you're getting ready for the flight. And they're all excited. The other person is panicked out of their mind because they're afraid to fly, right? Same exact situation. We've both got a free trip to Hawaii. But for one person, it's a horrible stressor getting on that plane. And for the other person, it's like, yay, right? So it's not so much the stressor, but it's our reaction and how we respond to that stressor, our neuropsychophysical reaction to the stress.
And is that our habitual response to that same kind of stressor?
That's what becomes habitual. Okay. See, if we experience something once, well, it's not going to become habitual, let's face it. But if we experience something a number of times and then that becomes our way of managing that type of stressor, we read a lot. And one of the things I was reading about the nursing profession, that among the highest stressors is it, the number of patients that they have to see? Well, that's one of them. Yeah. Is it, the administration they work under? Yeah, that's part of it. Is it the conditions under which they work, the facility, the physical plant, everything about it? Yeah, that's part of it. Yeah, but a bigger one is conflict resolution among employees and staff. whoa, wait a minute, what's going on
Absolutely
here?
agree with you.
You know,
Well, even conflict resolution with yourself.
oh, indeed.
Because there are some of us who don't do very well in that department either.
Well, I think we're saving that for the conference. That's really a big one. But, you know, part of what we've done in our program is teach people how to deal with these types of conflicts at the workplace and what that is doing physiologically to you and to everyone you interact with. Okay? Because, you know, one of the things we're really big on is, number one, it has to make sense. What we do has to make sense. There should be no conflict between a Western trained practitioner, anatomist, physiologist, whatever they want to be, and an alternative practitioner if we're all dealing with the same reality. It has to make sense. So over the years, I said, okay, let's figure out this so-called conflict. And what I've come up with, and what I think, you know, Alba has continually helped to prove through research, is that it's about the stress response. Okay? Every organism down to the microbes have a stress response. Okay? And that stress response either moves you forward because you're searching for whatever your needs are that need to be fulfilled, or they hold you back, presenting itself as fear, hesitation, doubt. Okay? That's the stress response. And what determines whether the stress response is pathological?
Perception.
Well, you know, again, it's number one, it's our perception. Number two, I throw it as better than number one, is not understanding what it is.
Yeah.
You know, if we don't understand, there is no one, I would think, that doesn't or hasn't experienced the feeling of butterflies in their stomach.
Yeah.
For whatever reason, for the good, the bad, and everything in between. Okay, what is that? That's your stress response. Now, some people may define that as, ooh, I felt that. That tickled. Somebody else might go, oh, I think I have intestinal cancer. Okay, what's going on here? What's going on? It's how we respond to the stressor. Some of that response is automatic. And that's what I saw when I first met you. You said something, you know, clearly you said, oh, you had spasms in your jaw and in your head and spasms in your back. Okay, spasms. What are spasms? They're muscular contractions. Okay, well, if you knew you had spasms, why didn't you stop it?
Right.
I mean, you're an educated woman. You know you have spasms, and I'm not picking on you. I'm saying any of us.
Yeah. That's fine. You can pick on me. I fit all of the dumb things that people have done. I've done them.
We know
One of the reason I laughed at the intestinal cancer is I certainly have gone that kind of direction on a lot of things, so it made me laugh.
Do I have a story to tell you? But that'll come later. You know, but it's the stress response. Now, how do we respond to stress? You know, somebody gets bad news. What do? They get butterflies? No, they collapse. They faint. Okay, that's one response. That's actually a very intense survival response. When the brain says, that's it, I've had enough, and we pass out.
Yeah.
Because if there's nothing wrong, what happens? Oh, you wake up and I feel better now. Because your brain says, that's it, we've reached our limit.
Yeah.
But for nurses, for police officers that I used to be one many lifetimes ago, the stress, the daily stress that comes with these occupations, where's the outlet for that? The outlet sometimes on the day off with, you know, a couple of drinks for some people, or the yelling at the kids or yelling at the spouse, or, you know, the interpersonal conflicts at work. Those are the organism, if you want to get outright straight out, the organism's attempt to deal with stress. Okay? To stop that stress or to prevent it from becoming pathological. You know, stress in and of itself is not pathological. It's only pathological when it reaches a level that the organism can no longer adapt to successfully.
Right.
So when you present yourself with muscle spasms, I see those muscle spasms. In my brain, I'm looking at your body, no offense, I'm looking through your clothes, I'm looking through your body. I'm trying to understand, how is she holding herself in that way? Okay, her jaw's in spasm. What is she doing to hold her jaw in spasm? Oh, well, she's clenching the masseter. She's clenching, sternocleidomastoid. She's, we could rattle off all the muscles you're tensing. And then I say, okay, why are you doing that? Okay. And so you might come into my office, and my solution for that immediately might be to tell you a joke. What? To get you laughing, because if you're laughing, you can't hold your muscles in spasm.
Yes, I've discovered that. Because of time, I want to move ahead. I'll bet almost every nurse who is under phenomenal stress, and that pretty much covers any nurse who's been working the last 3 years or more, but particularly the last 3 years, is going to tell you that there is no time to release the stress. There is no time when you're in, the patient is coding, and not only that, but you have 3 other patients who are coding down the hall. And are you going to get the support and help that you need for your patient? Then you've got family that are trying to get answers to their questions from you at the moment you're trying to help their loved one. So these are the kinds of things where they feel like the stressors are beyond their ability. I mean, great, tell a joke, or, take some deep breaths or whatever, but they don't even feel like they have the capacity to do that.
I agree with you in part, but I think what's missing from that is they don't have the knowledge and the tools to deal with that.
And
to notice when it's coming and change it before.
I'd like to share a real quick story about that. My cousin, who was a nurse, she was in charge of an emergency room department. She was in charge of the emergency room department at a major hospital. And one day she started getting this weird pain in her neck and her shoulder. And within a couple hours, she couldn't move her hand and she was in agony, and she goes to the emergency room. And they're checking her for everything. They can't figure out what's going on. She's admitted. They run every imaging imaginable, every test. She's in agony. They're giving her every medication they can think of. Nothing is touching the pain. So after 5 or 6 days, I forget which, she comes home, and I'm speaking with her, and she's telling me what happened. I said, well, stop by and we'll show you something. And so I had her meet with Ramon, and he showed her something very simple that she could do. And in 5 minutes, her pain was down by 50%. And you go, how is that possible, right? How is that possible? Like, do you have 5 minutes, right? And so by the second day after she had been doing these movements, these are very simple movements. They're part of the somatic functional therapy. The idea is you've got those muscles in contraction. How do we get your brain to go, wait, this reflex is not helping me, it's hurting me. I don't need them to be in contraction. Let me release them and get them back to neutral. So it was basically some movements just to teach her that. So within a couple of days, 2 or 3 days, she was back at work. And then whenever she felt that, because it's about awareness, right? Being aware of when that stress response is starting to occur, she would get down on the floor, do these movements for 2 or 3 minutes, and she was back and she was fine. And I don't think she's had problems with it since. Maybe we can have her, hopefully we can get her to come to the conference. And
that would be wonderful.
But that's what he means. They didn't have the knowledge. She didn't have the knowledge what was causing that horrible pain. It was muscles that had gone into spasm because of that horrible, stressful place where she was, right? All the stress that was going on. And she didn't have the knowledge, and she didn't have the tools. And she learned the tools. And then that's something that she can use every single day of her life, right? Anytime she needs it, she knows now what to do. And she was
now she has a choice. It's not, this is happening to me, or somebody is doing something to me. This is, okay, this is my reaction to this type of stress. I have a choice of ignoring it, doing something about it that may or may not help, or doing this thing that I've learned that's pretty simple, takes a few minutes, and then I can get back to whatever it is I need to do.
Yeah, she would just go into the break room, lay down on the floor for 2 minutes, and not all of the movements require laying down, but they're just simple tools. And we've taught these tools to thousands of people in group programs. We've taught them over the phone, we've taught them on the internet, and this is the program that's been researched. And the exciting thing is that the nurses can learn to do them for themselves, to stop pain in its tracks, to stop and reverse, stop the progress of and reverse chronic illnesses, sleep, insomnia, anxiety, depression, all these stress-related conditions that have gone through the roof in the last, 2 or 3 years. But also they can be trained and certified to teach their patients these things. So that when
I'm convinced, you guys have really convinced me. I am coming to Power Up Nursing. I'm bringing all of my challenges, and I'm going to see if I can, get some help from you. So what am I going to experience with what you're presenting? What is it that I can expect?
One of the biggest, I guess, alternative movements that's been out there for since the early 70s is this mindfulness-based meditation programs. Yeah. And they're good. They have their place. They've been taught to thousands, tens of thousands of nurses and physicians. And our program takes that to the next level. Okay. So for any nurse who's been a member of the American Holistic Nurses Association, or who have had training in mindfulness-based practices, this takes it to a whole other level. This takes yoga and acupuncture and chiropractic and osteopathy and Pilates and exercise, and makes sense of how is it that for some people all these different practices have some benefit. Okay, why not for everyone? And why can't they be reproduced? Why can't they be tested? And why don't they sometimes not make any sense? Okay, what if you could learn something that takes your existing knowledge base? You're a nurse, which means in part you're a scientist. That's what you study. Yes,
we rarely give ourselves credit for that, but we are
scientists. And as scientists, what if you could use that background to look at something and go, yeah, this makes sense to us, and we can do it, and we can learn it, and we can present it to our patients.
Right.
That's what we want to offer at this conference. Because nurses, we know they're getting burnt out. Okay, so what do they do next? It's one thing, and I mean this with all due respect, it's one thing when you've been in nursing 30, 40, 50 years to say, now I'm looking for an alternative. I know nurses who have been in nursing 2 years and want to get out so bad, but they don't know what else can they do with the training they have, and there's only so many podcasts available.
Right. Oh, well, I don't know. It seems unlimited to me.
Every day, new ones, by the hundred. But what we're saying is, look, let's take that knowledge you already have. Let's take the love of nursing, which is what I've seen, because I've had a tremendous experience very recently with nursing, is the wanting to deliver care.
Yeah.
Let's take it to a whole other level. Let's show you how you can not only take care of yourself and prove it to yourself, but then extend that to your patients.
Yeah. I think one frustration for nurses that I hear a lot, and probably you do too, is this concept that they feel like the industry of healthcare that they are practicing in seems to be more about disease care. And it's actually a benefit to those people that are promoting it to have people returning again and again and again. I had one nurse told me that a CEO told her, we don't want people to be well. We need butts in our beds. And that was a quote. Wow. Butts in our beds. How does this work if we're actually helping people to be well? All these people that are wanting to make tons of money, what they're doing is probably not going to work going forward.
Obviously there's a place for conventional medicine.
Yes.
Okay, for the research that's being done. I mean, I am fascinated every day by new medical discoveries and the level of understanding, the commitment that it takes. Okay, but I also see the closed-mindedness that exists in all of these different camps.
Yeah.
of, well, we have the answers.
Right.
No, we do. Look, patients present themselves to us and they're looking for something. They're looking for help. Well, guess what? If you're the nurse, if you're the physician who can provide that, you're the one they're going to go to. Are there CEOs and administrators and physicians and nurses and people like me who are selfish and see the almighty dollar? No question about it. But I think the number of people who went into nursing and into medicine with that intent are small.
Yeah.
Do they become jaded? We already know the answer to that.
Yes.
But what if we could bring the joy of practice, the joy of medicine back into medicine?
Yeah.
Okay.
And I think that's what I'm hearing is nurses don't want to be doing this, but they do want to be doing that caring aspect that brings a positive result, not just to that patient, but to their family, maybe their neighbors, any number of other people. So,
we have our medical director, Dr. Joe Sulkowski.
Yeah.
And one day I'll let him tell you some of the stories of his experience with SFT in practice. The joy that comes out of him when he's telling you his experiences just leave us dumbfounded.
He calls us and says, "Oh my gosh, you won't believe what happened today. It was so amazing." And, just like excited and happy. And when do you see that? Same thing for nurses. Like, what if when you went to work, let's say you work at a hospital and you have a patient who's in the bed in agony with horrible back pain, which happens because they're laying there in this bed. My mother just had an injury and spent a month in the hospital. They're laying there in agony. What if there was something you can do in 5 minutes, or that you could teach that patient that patient would feel a lot better? Like, wouldn't that be wonderful with no side effects?
Wonderful.
No risk of interaction with another medication, no risk of adverse effects, no risk of, but they would feel better in that moment. So, like, what kind of joy does that bring to a nurse? Because we know that the nurses are the ones who care about the person, right? Some of the doctors, not all of them, but some of them are like, oh yeah, there's a knee replacement over in bed 1, and there's a heart attack in bed 2. To the nurses, that's a person. Right. And that nurse cares about that whole person, not just about the person's knee or the person's toe or the person's, whatever. They care about that whole person, and they're concerned about helping that person. So if you're able to relieve that patient's stress and pain when they're in the hospital, which was one of the most stressful, painful places to be, that brings back the reason why you went into nursing in the first place. Yeah. Nobody went in there to change bedpans or to, hand out pills in little cups. That's not what nurses go into nursing for. They go to help people heal. And if you can do that.
And any monkey can do that.
Right.
We were told for years, you nurses are dime a dozen, what you do is not that beneficial. But the reality is those things you just described are the only things they know about that we do. They don't have any idea of the depth of connections and how we impact healing with patients. We're at the end of our time, and I'm so sad. But I also want to give you both an opportunity. What's your last statement? What do you want to say that will impel all those people that are out there on the fence saying, yeah, I'll register tomorrow? What do you want them to know about coming to Orlando, June 22nd to the 24th for Power Up Nursing?
Well, I would say come. Come if you're wanting to get back that joy. We would talk about the science and art of medicine, the art, right? Mm-hmm. That feeling of accomplishment, of contentment, of happiness that you feel when you've helped somebody to heal, to feel better, to recover. Come and learn. Come and experience being with other people of that same mindset, that's what there's about. The same people with the same mission, with the same values that are looking to how can I be a better nurse? How can I feel better in what I do? And how can I help my patients and the people that I interact with on a daily basis?
Yeah, I would definitely say to the nurses, to the wannabe nurses. This is an opportunity to transform your profession, to transform healthcare, and to transform your life.
Yeah.
What we're prepared to share with you can transform your life.
Yep.
The rest is up to you.
It is so wonderful to have those options. If you don't have the options, it's very difficult to change your choices. And so I think that's really one of the things that you're saying, and I think that's what we're saying, is that many, many, many nurses do not recognize the power that we have because we have not given us enough options. And that's what we want to do in this conference, is really help nurses to understand it's not about what somebody else does to you. It's not about what is set up for you. It's about what can you do? What action, what power can you find within yourself and share with other people? And that's what I want to see nurses taking charge of nursing and transforming healthcare. And I believe that can happen.
And that's why it's called Power Up Nursing.
That's why it's called Power Up Nursing. So I hope everyone will come join us. Bring your friends, bring your colleagues, and you will not be sorry you did. We'll see you then.
We'll be there.
Yeah, I can't wait. Hugs are good.
Thank you.